Seconds on the nose, so we're going to go ahead and kick off today's conversation. Hello, everyone, and thank you for joining. I'm Alexis Williams, EVP at the Stagwell Group. Welcome to the 7th webinar in our Back to the Future series. As we begin reopening across the country, and in some cases, unfortunately, reclosing, it's clear the world we're coming back to is going to be quite different. While in some cases we'll revert to our pre-COVID ways, many of the behaviors and habits we've developed over the last few months will stay for good. To help unpack what a future state might look like, the Stagwell Group has been talking to colleagues across the marketing industry to hear more about how COVID-19 has changed their businesses, how they're managing through the crisis, and importantly, keeping an eye to the future. Today's conversation couldn't be more timely and really is at the core of the global pandemic, healthcare. In preparing for today's conversation and about the dialogue we're going to have, a fundamental dichotomy stuck out to me. Healthcare exists in two simultaneous polarities. On one side, the business of healthcare, which is on track to account for approximately 18 to 20% of GDP and is incredibly complex, from doctors to hospitals to insurers to drug companies to government regulations and policies and so much more. On the other side, and equally if not more important, is the innately human side. Healthcare is the potential savior when you or a loved one are facing a life-threatening illness, an intimate, personalized service that you often interact with during your most vulnerable moments. Now, if that wasn't enough in terms of complexity, add the strain of a global pandemic to all of it, and we're in a really interesting moment for the sector. COVID-19 has highlighted the incredible heroism of frontline healthcare workers, and we've seen the country rally behind medical professionals who stepped up to serve and provide care amidst so much unknown. We've also seen scientists and researchers working tirelessly to find a vaccine that could get us all back to our normal lives safely. On the other side, COVID has also highlighted the systemic flaws in the system that we all knew existed, but oftentimes unfortunately ignored. From seeing the terrible toll COVID has played with the elderly population, especially those living in assisted living communities, to the disproportionate impact COVID has had on the BIPOC community. With all that said, and as an eternal optimist, the trends emerging from COVID show great hope for the future of healthcare, that is a hope in a future that is humanized, personalized, and patient-centered, importantly for all patients. And that's what we're going to be discussing on today's webinar. We have an incredible group of panelists today, and I'm going to ask that they introduce themselves. For ease, I will cue you, but we're going to go alphabetical by last name. Nice old-fashioned way of doing it. So with that said, Aurora, could you please introduce yourself? Oops, Aurora, I think you might be muted.
Good afternoon, everyone. My name is Aurora Archer. I am the founder and CEO of the Bellatrix Group, a marketing and consulting firm focused in the health and wellness space.
Perfect. Paul?
Good afternoon. I'm Paul Matson. I'm the Chief Marketing and Communications Officer for the Cleveland Clinic.
Great. Ned?
Good afternoon, I'm Ned Russell. I'm the Managing Partner of Healthcare for the Anomaly Alliance of Agencies.
Great. Richard?
Hi, I'm Richard Schwabacher. I'm Vice President for Customer Experience and Engagement at Pfizer.
Wonderful. And last but certainly not least, Treff.
Hey, I'm Mike Treff. I'm the president of Code and Theory, which is a digital-first creative agency that does a lot of work in the healthcare and digital transformation space.
Great. Well, thank you all so much for taking the time to be here. I know how crazy everyone's schedule is, and we can't wait to hear more from you. Before we jump into the conversation, a few programming notes. This is going to be about 45 to 50 minutes, but we want to reserve a large portion at the end for question and answer. So there is a Q&A button at the bottom of your screen. Submit your questions through there. I'll be tracking them and monitoring them. Feel free to bring them in at any time. To our panelists, this is a conversation, so jump in, feed off of each other. I can't wait to see the interaction. I think that's going to be part of the best part of the conversation. And with that said, I'm going to get started. So I do want the majority of the dialogue we have with this group to be future facing, but I think we have to take a step back and spend a little bit of time talking about the outbreak of COVID-19 and how your business has had to adapt, because I would say the healthcare industry, as I mentioned in my introduction, really was the front lines of this and really had to make a lot of changes with a lot of unknowns. So to add to that, I would say this time last year, if I were, I would not say we'd be in this position. So it's a very uncharted territory for us. So, I guess, Richard, I wanted to start with you. Looking back, to the very beginning of the outbreak, sort of the beginning of this year, January, there were stories about something brewing in Wuhan. We sort of saw it coming to the US in early February. In the very, very early moments of this, how did Pfizer sort of initially respond?
So, I mean, it's interesting. And I think one of the benefits of being a global organization is that we were actually able to see things firsthand, which helped prepare. And as things sort of spread around the globe, we just kept refining our plans. And I think we had the benefit of being able to do that. I think a lot of organizations did not. And so, I think we're all trying to figure out exactly what that means now that we're hopefully starting to face the opportunity to reopen. And in some cases, we'll see where there's reopenings and then, closings or changes in protocols. And I think it's going to be incredibly disruptive for a period of time. But I think that disruption is also going to create some new opportunities for us, and it's actually going to accelerate our thinking around new ways of engaging with patients, physicians, and one another, because we're forced to. We don't have the benefit of waiting to see if this evolves. And I think what's really important is the things that made good experiences and good design strong, the integrity of good design, are going to be the things that are going to carry us forward in the face of this challenge. And so, we need good design now more than ever.
Yeah. And Paul, in terms of frontline, Cleveland Clinic was certainly out there as a major hospital system. Tell us a little bit about the early days. What was it like? How did you sort of adapt and think about taking care of, importantly, patients in this?
Sure. Yeah, sure. So we have a medical operations and incident command structure at the Cleveland Clinic. And that incident command group identified and started tracking the virus in January. So we started our preparations in January. It was fascinating. I would say right up until the first week of March. It was really all study and trying to understand the impact. And I remember the first week in March, we were discussing putting some minimal travel restrictions in place for our staff. And of course, things accelerated quickly from there. Ohio, we've had great leadership at the state level. We also have hospitals in Florida. But in Ohio, we had great leadership at the state level with Governor DeWine. Rapidly, non-essential surgeries were restricted in the state. So our business declined to about 20% of its normal activity levels, primarily in essential services like heart and cancer and other emergency services. We started building a surge hospital with over 1,000 beds of additional capacity. And we stood up one of the first drive-through testing locations in the country. And in the early days, that was the biggest challenge, as you know, really trying to have sufficient testing to manage all the demand that was in the marketplace. Fortunately, in Ohio, we never saw the surge, and our capacity was something we were able to manage well within our existing ICU and hospital bed capacity. We're now actually taking that facility down and returning it to normal operations. Florida, we're primarily in Broward County and Martin County and Vero Beach. So in that east coast of Florida area, even there with the high number of cases we're seeing, right now we have a very manageable level of hospitalization. So we've worked closely with the state on testing and education. Right now we're doing a lot of work with companies around the country and around the world, helping them restart their businesses and put safe practices in place. So the last 100 days, it's been quite a journey. And I think we're well positioned now because we have now significantly more testing capacity to go in and track and trace and deal with hotspots around the regions in which we serve.
Yeah. And, so to piggyback off of that, and I think, Paul, I'll turn to you, and then Aurora, I'd love your thoughts on this as well. But one of the things we saw in the beginning phases of COVID was this sort of desire for credible information. There was plenty of information out there, but there was really the desire for a trusted source to come out, speak definitively and clearly, and say what they do and don't know was really essential. So what role did the Cleveland Clinic play in sort of becoming one of those trusted sources for people? And how did you ramp up what is really sort of a new function for someone like you, which is a content development?
Yeah, so actually it's not really a new function for us. I mean, we're very much a content-driven brand. In healthcare, I think if we were to step back and think broadly about what we do in normal times, we're content driven. People choose healthcare when they're seeking healthcare providers. They start by looking for information on their disease and condition. We are one of the leading health libraries in the country. We have extensive social media resources. Our Health Essentials platform is the leading healthcare provider blog in the country. And our digital channels have really grown exponentially. So the strong digital foundation we had served us extremely well and expanded. So for example, our website will have we had 200 million visits last year. We'll have 250 million visits this year. Wow. Since March 13th, we've created almost 7,000 social media posts. Primarily on our Health Essentials blog, but also our physician blog, Consult QD. That's generated 120 million impressions. Early on, that was almost all COVID education. It's not promotion of services. Our goal is to provide helpful information to communities and patients. And it's run the gamut from masking to testing to how do women who are pregnant deal with COVID. I mean, literally with 7,000 posts, you can imagine we've covered the range of topics. That served us extremely well. We've actually now seen consumer interest pivot away from COVID back to, as healthcare is resuming, back to other topics. The other thing is we put our experts out in the media. So our infectious disease leaders, women's health leaders, men's health leaders. We've done a lot of outreach as well to communities. We've been working with, Cleveland's a majority minority city, so we've been working with the local churches and neighborhood leaders to make sure we're getting healthcare information out to communities. So I think you put your finger on it. Trusted content, to me, is the linchpin of any good healthcare organization's communication strategy.
Yeah. And Aurora, obviously from the marketing side of the house and what you do with your clients, talk to us a little bit about content as a vehicle and how you've sort of seen that evolve as in the wake of COVID, and especially as you think about diverse and underrepresented communities.
Yeah, so I think what I would build on what Paul said as far as trusted content. I think it's also about trusted vessels. Right. So I think that within the BIPOC community, it was also about how is that content translated into tangible execution and understanding by our thought leaders in health. And I think that's what you saw in sort of the Spanish community, the Latino community, as well as the African American community is, okay, this is great. These are some of these, major trusted sources, but there's also, as I'm sure most of us know, there's also a level of distrust there. And so how is that content communicated by the leaders that we trust? Paul mentioned church communities leaders, church leaders, community leaders that are really on the ground managing and supporting our communities and understand sort of the nuances and how COVID actually predominantly and over significantly impacted our communities.
Yeah, that's great. And then, Richard and Treff, for you all, thinking about this from a systems perspective, in order to create the amount of content, make sure people are seeing the content in a way that they can digest on platforms where they are, thinking about the systems and really with that sort of patient first mentality, how do you, and I will defer to either of you on who wants to jump in first, but how do you think about especially in a heightened timeline like COVID creating a system that's actually going to support that need and demand so that patients are getting the information they need?
Yeah, Ned, I don't know if you want me to go first, but I'll jump in.
Go for it.
Okay. I mean, certainly there's a multitude of factors when you think about the system design for that. There's one, where are you getting the information from? How are you making sure that it's translatable, understandable? How do you associate the content to the right format? Should it be a video? Should it be an infographic? Should it be a quote? Should it be a report? You know, those are all early considerations. The second consideration is, how are you publishing and distributing it, and where? So are you putting it on your own channels? Are you putting it into media? Are you partnering with media publications or other distribution points to get that information to where people need to get it? And then the third piece out of four is, how are you sort of ensuring speed to publish? Are you able to publish and get the information out as quickly as it needs to? Because certainly the desire from a consumer perspective, from a patient perspective, from a human perspective, is you want important information quick, timely, easily, and understandably. So the operational side of how are your content creation organizations set up, what workflows are they using, are critically important in those moments. And then lastly, not to lose this point, and everyone says this, but we should know how the content's doing. So how are you tracking it? How are you analyzing success? What are the KPIs? And what is the outcome that you want people who read or obtain that information? What do you want them to do with that? Sometimes that's just read it, understand it. It's important for people's health, for people's lives. Sometimes you want to spur action, and it's important to align KPIs and analysis against that. That's how we would approach it with our client partners.
Yeah. And Richard, anything to add from the Pfizer standpoint? I know you're doing a ton on the customer and sort of the patient journey. Is there anything sort of that you're doing specifically around content that you think has changed or evolved in the wake of COVID, especially with the emphasis on digital at this moment?
Yeah, I mean, I think we're listening. I think that's the most important thing, because COVID has forever changed the patient and the physician experience. I mean, if you think about the common primary care physician in the United States and assume that they see their patients for on average about 13 minutes, on a given day. In any day, they were seeing pre-COVID about 40 patients, which equates to about 200 a week. That's not going to happen anymore. Patients are not going to sit in a waiting room. They're going to be, queued up in parking lots and open spaces. The administrative staff is going to have to, escort them. And, the physicians and healthcare providers like Paul, and I'm actually curious to see how Paul might react to this, but I mean, they have to now manage contact tracing within the healthcare provider community, which means that they have to start pairing up their providers with one another so that if there is an infection or a quarantine situation, they can control it and prevent further spread of the virus. All of this is going to have a profound impact on how and where we deliver content and information, where patients and physicians go to seek that information, and how they validate that it's coming from a trusted source. And I think most importantly, everyone is just very thirsty for information that's going to be relevant to their patients. So if you look at, and what I was most struck by is in the United States, if you look at the last meeting of the Fed, they said, the economy is starting to crater a little bit and it's led by healthcare. We don't understand this. Most financial analysts didn't understand it. Well, the reason why is exactly what Paul said. Everything became COVID all the time. And now as we're starting to reemerge, oncologists are trying to understand, okay, well now how do I practice, treating cancer patients in this new world? How do I keep them safe? How do I keep myself safe? And how do I get them information? And I think that's going to have a systemic effect. And the good news is people like Mike are thinking about how do you actually create those new content delivery channels in a meaningful way so that we're able to get that information to the physicians and the patients. But listening is the most important thing, Alexis, because I think we're all trying to see how we begin to emerge from this around the world, frankly.
Right, that's great. Well, with that, I want to sort of pivot to future state and talking about how, knowing what we know now, still with a lot of unknowns, but a lot more clarity than we had, say, in March, how can we use this as a moment of a catalyst for change and for good? And so, Aurora, I found a quote of yours online that I'm going to read to the group, which is, "We believe the umbrella for this new vision of health is connectedness, a nation of connection that is focused on treating, serving, and honoring the whole person, the linkages between the health and wellness of individuals, and the desire that humans have for their experiences with healthcare to be no different than those that they have with retail, financial services, and other businesses and brands." So it's a great quote, but as we think about COVID as this watershed moment where we can really reassess and in some ways reimagine the patient experience, from your perspective, what are some of the critical elements to consider in the digital design process?
Well, I think it actually starts with what Richard was saying, which is first and foremost, listening. And I think listening with a much wider aperture. Secondly, I think it's about bringing a much broader group of individuals to the table in the creation and the design of what needs to be reimagined. I think that if anything, COVID showed us that there's an entire swath of humanity that is woefully being ignored, not understood, and certainly not serviced from a healthcare perspective. And I personally believe, having spent so many years in corporate America, it's a fundamental reflection of not having teams that are truly representing the experiences of those that we have been entrusted to serve. I think third, it's really, I think that understanding and that experience allows us to also look at not just sickness, solving for sickness, but proactively creating wellness as a third pillar. And I think for very long, our healthcare industry has continued to thrive on a model of sickness and not one that is also equally looking at preventative care and wellness as not only a way to support humanity and humans, but also in a way that supports the capital vectors of top and bottom line.
So then I guess, Paul and Annette, I'd turn it to you as well. When you're thinking about what can come of COVID and what is sort of the knowing that the consumer and the patient is going to have different expectations, how do you think about evolving your businesses to sort of reflect what Aurora said, which is the opportunity to create a more representative approach towards healthcare, a more preventative, holistic approach to healthcare? And either of you can jump in.
Paul, you go ahead.
You sure? Okay. I think that's obviously a large, complex question. I think that one of the keys from my perspective in healthcare, like virtually every other industry in the US, patients are in control of their healthcare journey, much more so than healthcare providers. And technology is now enabling patients to have more information and more control than ever before. So, Treff was talking about the change in inpatient facilities. We're reducing our inpatient capacity and for outpatient visits by 25% so we can maintain social distancing. So, we have to increase our virtual visit capacity to be 25% of our clinic visits going forward. And that gives the patient the opportunity to choose where they'd like to receive care based on their own comfort level, their own medical condition. They might be caring for a loved one, an older person who doesn't have mobility. So that's one piece. We've been a pioneer in electronic medical records, making sure that patients have all the information they need to make good decisions, ask the right questions. And increasingly, we're turning to CRM technology to reach out to them to make sure they're staying consistent with their care, up to date with their care, and bringing those things into healthcare, which have been present in other industries. Again, content's a big part of this. What we have found, if someone's diagnosed with a disease or condition and they come to Cleveland Clinic digital properties, they basically consume all the content we have to offer. And our goal is to help them navigate through to find what they're looking for and connect them to the right care resources as they go forward. So I think it's very personal. I think also technology in healthcare can enable this now. It's coming rapidly in ways we haven't seen before. I do think the community piece, healthcare organizations realize that they have to play a proactive role and partner with other community stakeholders, hospitals and delivery systems can't do it all. But we're working, Cleveland as a city just declared racism a public health issue. So we're working closely with the city on measures to address that, putting testing sites into local underserved communities as an example. The last piece I'll mention, and it's a huge topic unto itself, but it's worthy of discussion at some point, is the medical community and caregivers themselves. COVID has been an incredibly stressful situation for them. They've been on the front lines, as we talked about, and we have spent as much time and effort communicating with our caregivers as we have with the public. Our CEO, we do 2 videos a week. You can find them all on YouTube. We do 2 videos a week. We do multiple written messages a week. Our caregivers have opened and read over 3 million email opens from our CEO since COVID started in the beginning of March, because they are hungry to know, what are we doing to keep them safe? How should they respond, protect their families? And our belief system is we can't provide the highest level of patient care unless we take care of our caregivers as well. So I think for us, it's a very holistic approach as we move forward.
Great. Before we move off this point, Richard, Trefnet, anything you want to add?
Well, what I'd like to say is that healthcare is an industry, right? If we observe the obvious, that was always built to scale. And even at the best companies, a patient was sort of a nondescript being. And what's happened with COVID, is that it's impacted everyone. And so the change that's going to come out of this is that healthcare is going to become very personal. And a lot of this has been put into place before the pandemic happened. So it just so happens that in early March, HHS released its interoperability guidelines so that a patient can carry her or his own health records with them and use them like they do their travel or retail or financial records. Telehealth has, of course, been around for years, and we've been waiting for the time. Proactive, predictive health is coming on stream. And so in a way, technology, as Paul said, in terms of usage of digital content from the clinic, it's not surprising because technology provides a safe place for patients to engage in their health, which people as humans really don't want to do unless there's an issue. Yet in the last minute, there's been 70,000 health-related questions asked on Google. So it's a very interesting move that's happening, but the move that's happening, many of the steps were put into place before the pandemic hit.
Right. And if I could just layer in one small point, I think looking at it from a patient perspective in terms of what are the difference in expectations are going to be key in terms of creating the services and the interfaces and the experiences that will work for patients. I mean, there's certainly ever-changed expectations around access to care, access to information, the platforms and the touch points they can do that on. Certainly there's changes in terms of the speed to which information should be available, whether it's testing results or whether it's any other sort of diagnostic or just access to information around what's available to me in my healthcare universe as a patient. Like, these are expectations that consumers have now thrust to the forefront because of COVID that are not going to go back. So in designing these services and designing the experiences and designing the content, I think it's very important, sort of to Aurora's point, to be very, very much aware of a diversity of voices, of all of the different needs that are out there, and then designed specifically for those variants of needs.
And if I could just add one point to just emphasize what Mike just said, I think that the reality is that healthcare as an industry has received a pass long enough. And what do I mean by that? In every other industry, digital and technology have transformed the empowerment of the consumer's voice and the consumer's choice. And I think what COVID has brought is a reckoning on many levels, but one with regards to it no longer gets a pass to have this non-frictionless experience that, quite frankly, as a consumer, I experience in other aspects of my life, whether in dealing with my banking, whether in dealing with my retail. It's like, why is it that when I get to this aspect of my life, I'm expected to endure these series of barriers to support my choice? And I think that that is what has also been brought to the forefront, where I'm just no longer willing. I think consumers are going to continue to become empowered with technology, and they just are not going to be willing to endure this very arduous model that has existed for way too long.
I think that's a fantastic point and a really good segue to sort of the next piece of this conversation, which is really around telehealth. Since the start of the COVID-19 outbreak, the Harris Poll has been doing weekly polling of American consumers about how are they feeling, what are they worried about, where are their fears. And we've also done a fair amount on healthcare. And prior to COVID, only 10% of Americans said they ever used telehealth services. Now we're 17 weeks into this tracker, 44% of Americans said they've used telehealth services. So I really, if we think about it, this is the watershed, right? Does anyone feel as though this isn't going to be a moment of massive change? And I think the layer to that is the Cleveland Clinic, Pfizer, you have incredibly large organizations. How do you think about that change, and how do you actually think about addressing it in a moment where the pressure is on, to keep caring for patients, to keep developing new medicines and drugs to cure disease? How do you think about balancing the change, the needed change, what patients are going to expect, with making sure you're still meeting the expectations of people in the day-to-day? And that's a hard question, but I'd love your thoughts on that.
I think from our perspective, obviously during the height of the crisis, particularly in April, the spike in virtual visits was incredible. I think we went from doing about 5,000 a month to 200,000 in the month of April. All the restrictions were removed. Technology platforms were opened up. You could use Google Duo, you could use FaceTime, in addition to using platforms like American Well. The biggest change, in my opinion, was that the biggest barrier for adoption was removed, and that was physicians integrating it into their practice. Many physicians were very reluctant to use it. They didn't know how to integrate it into their practice. But when you're doing your entire outpatient practice from home, all of a sudden it becomes the only alternative, and all payment barriers were removed. So reimbursement was in place. So those things have to be sustained going forward. We just surveyed our own patients. We did a first wave through May 6th, and our own physicians. I think Aurora put her finger on it. It has to be simple. It has to be frictionless. It has to be integrated with the rest of our technology infrastructure. And then it's going to need us to build it into our core business processes. And that's what we're working on now. We're working on how do we sustain the gains we have. We've already seen things level back off to about 25% of our mix, but that's still well above where we were. But we have to help physicians integrate this into their practice. And a lot of things are under consideration. For example, extending to weekends, extending to early morning and evening hours, which is when a lot of patients want to have access to their physicians, and giving physicians to be flexible and practice from home, or on a flexible work schedule instead of a traditional work schedule. I will say, and humbling as a marketer, there was no marketing involved in getting to the record number of virtual visits. It wasn't a marketing barrier. Our consumer data says 80% of consumers are ready to do virtual visits. The barriers have been structural and cultural.
I think, Alexis, at Pfizer, one of our core values is that of equity. And everything that Paul just sort of outlined and that we've talked about previously, I think are all positives. I think the crisis that COVID has created is going to hasten our move to these solutions and create a much better experience for some portion of the population. I didn't read the Harris poll, but I'm curious if you if I went into the crosstabs and segmented it out by, you know, socioeconomic background, by, you know, diversity standards, you know, would those numbers hold true in African American and Hispanic communities and underserved communities? And my guess is that wouldn't. And I think what will also be hastened is the digital divide. And I think that that's something that everyone needs to sort of be cognizant of. And to Aurora's earlier point, yes, certainly we need to have more diversity in the creation of these solutions. But more importantly, I think we need to start thinking about how we're actually going to provide them. When you look at social determinants of health and you start thinking about those who are most susceptible to them, when you think about what digital could do to actually create meaningful change amongst the most vulnerable in our society, one of the biggest barriers is having a consistent phone number and device. I work very closely with a nonprofit that provides volunteer medicine to an underserved population, to the working poor in northern New Jersey. And for a long time, we have been thinking about how we use telemedicine. And you know, come March, we shifted completely to that model, and it was through the, you know, support of donors and grants that we received that we were able to do it. We still can't get to the most vulnerable patients though, because on the other end, they don't have the means to engage with the providers in a meaningful and sustained way. And so, you know, I think as an organization that values equity and wants to make sure that we're able to serve all of the patients, something that we all have to be thinking about is the digital divide and how that's going to actually impact the things that we create and the solutions we bring to bear. And so that's something that's very much on my mind, and I think on the mind of many of my colleagues.
Anything to add before? Oh, sorry, please,
So
Aurora.
let's just add two things. I think Richard is absolutely right with regards to the divide. And one thing I would just offer to the team here is that I also think it's very important that when we talk about diversity of culture, that we're not inherently mapping it to a socioeconomic realm. Because I think what we're talking about is two distinct things. I think we're talking about needs and expectations from a consumer that are determined by socioeconomic status. And I believe that it's also needs that are unique and personalized based on cultural dynamics, because we tend to conflate both of those things. And I think it's very important that we keep them separate, because I think they're actually Venn diagrams and they're not one and the same. And I would offer that as we look to create solutions and create solutions that are inclusive, both from a cultural diversity perspective, but also inclusive in understanding what are the unique needs socioeconomically.
I think that's a really great point. I do think there's one other aspect to bring up in this sphere, which is there's also a regulatory and legislative piece of this as well that can't be ignored. I mean, certainly if we're going to achieve the goals that we're laying out here in terms of access, in terms of the types of experiences that will be created, in terms of bringing it to the right people through the right devices in the right way, there's certainly regulatory and legislative reform that needs to go along with that to make that a reality. And that fight needs to happen.
Yeah, and that was actually a perfect segue to my next question. And Ned, I would ask if maybe you could jump in on this, but I think we all agree this is a moment, there's an opportunity here, but we have to deal with the reality of the policy, laws, and regulations that exist in healthcare, which is probably the most highly regulated industry we have. What are what needs to happen there, and what do we need to be thinking about to make sure that we can keep this push towards personalization going?
Well, you know, I'd start by saying the genie's out of the bottle, right? As we've been going through. And as a pandemic that has affected everyone, I think that healthcare and regulators know that they can't go back to their old ways. I also think that we need to be clear-eyed about where we were before the pandemic, meaning the current administration, say what you will about how the pandemic has been handled, was trying to make the FDA a little bit easier to navigate. And hopefully that's something that will continue. And really, when you look at how technology has transformed markets and industries, the math has been pretty simple, right? Technology makes the service or product easier to access, and it makes the payment model different, normally less expensive, but also a little bit more convenient for the end user. There is no product or service that has a more difficult to engage with model or that's harder to pay for than healthcare. So part of what I think has to be happening on a regulatory basis right now is that they've seen that things can actually get better, and therefore the momentum behind that has to stay in effect.
Got it. That's great. So we have a bunch of questions that have been submitted online, so I'm going to turn to those. But before I sort of open that up, any other further comments and sort of the policy regulation shifts that we think we need to see in order to keep this move to telemedicine and digital? And if not, that's okay too. All right. Okay. So first question, Paul, this one's directed at you. Specifically, how are you using CRM? And can you talk a little bit more about that?
Sure. If you don't mind me mentioning vendors, we're partnering with Microsoft and using Microsoft Dynamics. Interestingly, this is being spearheaded through our clinical organization and our IT group. We're in a support role, and we're doing we're in an early stage, so it's being used in several areas. One is getting people to return to care. So identifying people who, by our clinical criteria, have missed an appointment or a necessary visit, and reaching out to them either through their MyChart health record or by phone to get them to return to care. And to also understand, we're tracking why they're not returning, how much of it is safety or a need to talk to a physician, or what the barrier may be for them coming back, which is something we haven't really had before. The other is an application we call Visit Ready, which gets to the technology point of reducing friction, which is to accelerate pre-registration and financial pre-clearance. So that's all done before patients come in for their appointment. Sounds like something that should have happened a long time ago, but as you said, healthcare is where it is. So we're very much in the early stages of this. We also use another CRM-like platform, Marketo, for the management of all of our marketing programs. We've been doing a weekly patient email to 1 million patients, addressing concerns that we're hearing in real time through our contact center to try to, again, reduce the barriers to people returning to care. So those are 3 examples of what we're doing right now.
Got it. Next question, and Mike, I think maybe you can start with this one, and then others can jump in. Where do you see video coming into play during the provider-patient experience? For example, recordings of care instructions, provider-to-provider communications, EMR integration.
Well, it's a great question. I mean, certainly video is a highly effective format from a consumption perspective. It's very explanative, it's very direct, it can be very clear. For a long time, service and support functions have always been relegated to video for rightful reasons, because it works. Certainly that's not going to go away when it comes to diagnostic information and how to diagnose, when it comes to explanation of what's happening should you have a condition. It certainly can be very, very helpful there. When we talk about guidelines and restrictions, masks, social distancing, things of that nature, video is highly effective in consuming, and research report after research report shows that that's true. The challenge with video, because it's always a challenge, is really twofold. One, it sometimes takes longer to create, especially if it's going to be of quality. And 2, it's heavier to distribute. I don't mean heavier from an intellectual perspective. I mean, heavier on bandwidth. So when we talk about restricted access and people on, limited devices and bandwidth restrictions or poor internet connections, et cetera, it can get rendered useless. So a lot of thought needs to be put into not only the content and the subject matter, but also, again, the distribution points or even the cuts of it. So we can get, small bites of video to people who need it, who might not have access and bandwidth or the ability to consume longer form video. So all of those are considerations around video, but certainly it's an effective medium.
Yeah. Paul, Rinette, anything to add to that one?
I would agree. I agree with Mike's comments. Just to add a couple of Cleveland Clinic perspectives. We, because we have so many people who travel to Cleveland Clinic for care, we've created biographical videos for over 1,500 of our physicians that are on their searchable profiles. They're all 2 to 3 minutes and very easy to consume. Incredibly popular with consumers, patients, so they can meet their physician before they arrive at the office, and very popular with the docs as well. The other is we are very, very active on YouTube. We have thousands of videos. Most of our most watched videos are clinical in nature. Very surprising. We have a highly popular video called the empathy video that many people in healthcare have seen. But most people think people want to watch patient stories. It's not really patient stories that consumers turn to. They want clinical information, and they'll even watch surgeries because there is a cohort of people who they really want to understand their condition and what their treatment is going to be. Something I learned really early in this job. It was very surprising because people want to leap to patient stories and they have their place, but that's not what most consumers are seeking when they're looking for care.
Pardon my grimace. The blood thing freaks me out, but
most surgery is pretty bloodless now, so don't worry. Yeah.
But I would echo with what both Paul and Michael has said, and I think that there's an ability and an opportunity to be looking at video within the content strategy and within that customer journey, pre, during, and absolutely post. I mean, and I don't know that it's being effectively looked at from a broader perspective. And there's sort of this niche of its patient stories versus how are you empowering, how are you informing, and how are you supporting that consumer throughout their medical, either acute or chronic journey. And then I would also add that we do a lot of work in the women's health space, maternal health journey, and I think it's woefully underutilized in that space with regard to a 30-40 week cycle that women are in, and how are you using video in a much more effective and meeting them exactly where they are, not just leading up to delivery of a newborn life, but also post.
I would just add one other quick thought. We have developed here, we have an in-house medical art and photography staff that is now part of our team. Animations, graphics, illustrations can be incredibly powerful in addition to video. And that it's not always as sexy as video, but can be, in many cases, some of the animations we've done have been, just incredibly powerful.
All right, we are almost at time, but I like to leave these on sort of an optimistic and hopeful note. Again, this is back to the future. So the question I'm going to pose to everyone, and we'll go around the horn. How can we as consumers, we as leaders in our industry, keep the pressure on for positive change? And what is the catalyst and things that we can push forward to really have COVID not just be a pandemic that shook our lives, but a pandemic that shook our lives for the better? And so with that, I hate calling on people. I feel like such a teacher, but Richard, do you want to go first?
Sure. Thanks again for the opportunity to participate in the panel. Great hearing from, some of the best in the business doing some really interesting and innovative things. When I think about COVID and I think about all of the barriers that were in place, and many of them we've actually talked about, there is great opportunity and we're starting to see it. And I think things are going to change in a positive way because never in my lifetime has humanity gone through a singular experience at the same time. Every human has experienced COVID in some way, shape, or form. And I think that's a profound and remarkable and humbling thing. And I think if nothing else, it'll create some empathy and some opportunity for change and engagement. Healthcare is critically important from an economic standpoint, from a social standpoint, and from the survival of our humanity standpoint. And so I think we're all sort of paying attention right now, and it's a unique opportunity for leaders to sort of lean in, step up, and do whatever it is that they can. And I think that that's sort of the last thing I would add and sort of underscore and emphasize is that you don't necessarily need to be the leader of an organization. You don't need to be at the top of an org chart or in an elected office to create change. Really good ideas come from people who are closest to where they originate. So closest to the patient, closest to innovation. And now we have a stage that's been set to actually shine a light on those opportunities. So I'm very optimistic. I think, COVID is an awful thing, but I think it'll yield a lot of really positive change moving forward that'll move us in a better direction. So.
Great. Ned?
I think that we all recognize that we're in the early innings of what is profound change. And people get into healthcare because they want to make a difference. It doesn't matter if you're a practitioner, if you're in the commercial end, if you are doing anything else related to it, you want to make a positive change. Now is the chance. And I think that will stay with us for a long time.
Great. Trev, you want to go?
Sure. I would say, and it's to piggyback on what Richard was saying, he used a word that I like very much, which is empathy. And with great technology and great technology innovation must go hand in hand with human empathy, because at the end of the day, these are all products and changes and services and opportunities that are for humans, and they're for patients, and they're to improve lives. So that coupling of technology with a great empathy and understanding of patients and patient needs, I believe presents the greatest opportunity that we've seen in this industry probably since inception.
Great. Paul?
Yeah, a couple of thoughts. One is as it relates to the conversation we were having about inequities and disparities in healthcare. Awareness has certainly been raised through the COVID crisis, so that's been a positive. But I think obviously it's going to take a tremendous intentional effort on the part of all the stakeholders in the industry. Healthcare providers, we have a critical role to play to make progress. And I think we're having a lot of conversations and discussions now. The conversation we're having is how do we move it to action quickly? On the more upbeat, optimistic side, I've been in this role for some time, and we've spent a lot of years focusing on building digital platforms, building a content strategy, believing that was really the way to build our brand for the future. And I think COVID brought all of that home. The performance, the impact we've seen our digital content make in the last 100 days has been enormous. And it was, all the work and effort we've made positioned us well to serve our patients and serve our communities, and we'll keep building on that. And I also think this has forced providers to accelerate and take down the barriers to progressing things like virtual visits and CRM. I know in my organization, the commitment is redoubled to make those things work for the future.
That's great. And Aurora, last word to you.
Yes. So at Bellatrix, we think of this moment as this moment of reckoning, this moment of epic change is actually a moment of sacred transformation. Because of many of the things that my peers on this panelist have spoken to. And so, my call to action in this change would be threefold. One, I think it's about those in leadership that predominantly do not look like people like me. I think right now is the moment to have the courage and to dig deep within to dig deep here, to find that place of humanity, to find that place of care, to truly activate the change that is required and needed by all of us. And I get it, you know, having traversed the halls of many health organizations for over a decade, it's easier to just sort of let it pass. And so I would ask that we don't let it pass, but we step into that courage and we lead from a place of putting humanity first. And then secondarily, my call to action is to consumers to continue raising their voices and to continue using the power of their wallet to expect and in many cases demand change.
Well, that's an incredible note to end on. Richard, Paul, Ned, Mike, Aurora, thank you all so much for joining today's webinar. We really appreciate it, and I think based off the questions and attendance, it was very well received. So with that, a few programming notes. We're taking next week off, but we will be back the first week in July for our next webinar. The video from today's event will be posted on LinkedIn before the end of the day. So if you missed anything or want to see any other highlights, please go there. And if you'd like to be connected with any of the panelists or continue conversations, please let us know and we're happy to facilitate that. So with that, everyone, thank you all so much. Thank you to everyone who tuned in and have a great rest of your day. Bye-bye.
Thank
Thank
you.
you all. It's been a pleasure being here. Thank you.
Likewise.